Hi, I'm Jeff Walters, and welcome to The Minutes. And thanks for listening today. It's great to have you along on The Minutes this week. This is a City of Thunder Bay podcast. The Minutes takes a look at what happened at Thunder Bay City Council this past week. But this week we have a special edition of the show, looking at how the City of Thunder Bay operates. We have a couple of feature interviews with city management and administration, explaining how city services run all year long. You can find the Minutes wherever you get your podcasts, including our YouTube channel and our website, thunderbay.ca/theminutes. If you want to keep your finger on the pulse of what's happening at City Hall, just hit that subscribe button. When you need them, they will be there. Dial 911 in a medical emergency, and paramedics from Superior North EMS will show up to assist you. But the EMS service, which helps people in Thunder Bay and across the district, is constantly undergoing changes in how it responds to those requests for help. Shane Muir is the Chief of Superior North EMS. Shane, thanks for coming into the Minute Studio today.
Thanks for having me, Jeff. It's a pleasure to be here.
Yeah, glad you could make it in. So I'm going to start off with something that's been in the news quite a bit for a few years now, I'd say. We've heard a lot about really high call volumes for paramedics. So a new dispatching system introduced last year. Hasn't made any difference yet.
Oh, those are great questions, Jeff. And honestly, it's made a big impact. It's made a big impact to our service and how we deliver services to the community. Where we've really seen a difference is also in that paramedics kind of work balance. And it distributes those calls a little bit more evenly now. And we can get those advanced care paramedics to those critical calls when they need to be there and when times are really sensitive. So under the new MPDS dispatch, which stands for Medical Priority Dispatch System, we have basically a whole new subset of calls and how we can prioritize them. And they're kind of built into color codes now. So they range from green being the least acuity call and purple being the most high acuity call. And then in between it, we have a red, an orange, and a yellow. So all those calls have a time frame attached to them that the paramedics are required to respond in. So for a green call, they can actually be delayed for 4 hours if there's no crews available and other higher priority emergencies are coming in. Then those calls will get deferred, and we'll be responding to those reds and purples in a true time lights and sirens manner.
So what would like a green call be where someone can wait for a while?
Sometimes it could be as simple as no complaints. Somebody just wants a ride to the hospital for undisclosed reasons, or it may be something like a sore throat or something very minor that could be handled in a walk-in clinic. Generally, it does not need to be seen by a physician, and there will be no change to outcomes based on that time frame.
I know we've talked for a while about people calling ambulances when they don't really need them necessarily. You know, like they can walk to somewhere or they can get there on their own. Would that be an example of a green call kind of thing?
Absolutely, and it could be something that's a little more serious. For example, it might be from a car accident where you're still anticipating a response from paramedics to assess everybody, but nobody has any real serious injuries or complaints. So you're more going there for an assessment to check things over for bumps, bruises, those kind of things, rather than true emergencies where somebody needs to be dealt with in an emergency room very rapidly.
Okay, so I guess at the end of the day, though, paramedics still show up.
Absolutely. And that's something that we should really highlight is even if there is no other high acuity emergencies on the call, those calls are getting serviced right away. So it's not like there is usually any kind of delays. It's just a buffer into the system so that we can respond to those true emergencies quicker. But most of the time, we're still responding to those right away.
And when people, if one of the green calls one comes in and then a purple call comes in, the system's able to figure all that out?
That's exactly right, too. So now you are dispatched on a green call and you're rolling out and you're driving to that location and a purple happens to drop near you. That call will get rerouted to that ambulance crew so that they are the closest unit and will be responding.
Okay. So it can interrupt you mid-call as well.
And it might obviously put somebody else who's farther away and assign them to that call because it's not a time-sensitive matter. So you might still be getting that ambulance right away, but they might be coming from the other side of town versus that ambulance that's closer to that true emergency is going to get rerouted.
Okay. I know, as I said, we were speaking about high call volumes here, and for a while we were hearing about not enough ambulances on the road. Have we addressed that, or has this new system kind of helped that out?
So I would say this new system is helped a lot, and it's really helped the flow of how we're doing calls. So what we were seeing before with our DPCI system and the way we were dispatched is all the calls coming in were deemed as emergencies. So there you had basically two levels. That was a 3 or 4, and 3 would be an emergent, and a 3 would be an urgent, and a 4 would be like an emergent lights and sirens response. So basically all our calls were high acuity before. So even if they were low acuity in nature, once the paramedics arrived, they were racing out to that scene and they weren't able to get rerouted and those kind of things. So what it's really done is kind of built into that workflow so we don't have as much surge volume happening. And what we saw when we had a whole bunch of low acuity calls happening at once, as the ambulances would all get rolled out, they would all get their patients and they would all go to the hospital and then get stacked up in offload delay because there was no place to put them there. And then you have no crews able to respond to any emergencies in the community. So by distributing that workload and spacing things out and having people stay at home where they're actually a lot more comfortable than waiting in the back of an ambulance or in a hallway on a stretcher, you're getting a better healthcare system outcome from it. And we're seeing that those patients that really need the emergency department are getting in quicker, and the ones that can wait are just waiting in a more comfortable location.
And are you seeing changes at the hospital as well? I know, again, thinking of news stories over the years, offload delays were a big issue. Is that still the case?
So we've managed to decrease offload delays by a couple thousand hours this year with
That's
the new.
a lot.
Yeah, it's significant. It's still going to be an issue, and we still experience surge volumes where those offload delays are going to happen. But overall, the system is improving, and we're seeing a much better outcome with the MPDS.
Oh, okay, and that's all because of the dispatching system.
I like to attribute it to the dispatch system, but it's also in conjunction with a lot of the other initiatives that we're doing out there. We're being a lot more proactive in the healthcare setting, and especially in EMS. And some things that attribute to that would be like community paramedicine, where we have a whole department now that's being proactive in nature. So they're getting out there and seeing patients with chronic disease conditions, preventing exacerbations before they ever become emergencies. And what's that doing is saving us that emergency call. But not only that, we're keeping the population healthier on a general public health level, and they're not requiring that emergency ambulance anymore. And they're staying at home a lot more comfortable, a lot healthier. And we're preventing them from going into the emergency department when they have that exacerbation of that chronic condition and it becomes an emergency, and we're seeing long-term admissions from that. So if we can prevent those admissions, it creates a whole lot of flow through the hospital as well and the whole healthcare system.
So how does community paramedicine work? Because I'm assuming you have to sign up for it, or like obviously you need to know where to go.
Yeah, so it's a great program. Most of our referral sources come from the community, or they come directly from the paramedics that are responding to the 911 calls. They identify an incident or a patient that could benefit from it, and they will refer it over. A lot of the referrals come from either the hospital, home and community care, other agencies out in town. So we have a lot of referral pathways to get into the program. It's a great access. So what we're doing is improving the capacity of the healthcare system, and it's also mobile. So those people that have a hard time getting out to appointments from mobility issues or anything like that, our paramedics can get into the house, get eyes on them, do full assessments, and we're reporting back to the doctors and their primary care physicians. So we're really looping in everybody, and it's just kind of a healthcare system enhancer.
And are we able to provide, are we able to meet the demand, I guess, for community paramedicine, or is there a bit of catching up we can do there?
So I honestly believe that we could expand this program. It's something I'd like to see across the whole entire district. It's really, the core of it's located in the city of Thunder Bay right now, and we do have some district models in place, but we're having staffing challenges. Right now there's a need for paramedics in our community, and that's really across the whole entire nation. But here in Thunder Bay in the district, we have a need for paramedics, and we would like to see these programs expand and go forward. And in order to do that, we need the bodies and the paramedics to actually do that work.
Yeah, so how do we get more people?
So that's part of something we're doing right now as an initiative, and that's a big recruitment drive. So we've kind of done a bit of a culture change, and we're doing some branding, and we're really getting our image out there and trying to show the public and the rest of the community what our culture is. And we're doing that through social media activities, mainstream recruiting initiatives. We've gone in conjunction with a communications company, and they've created a bunch of materials for us, so like videos, lifestyle videos, and we're just really posting them all over everywhere that we can. So really get that interest in people becoming paramedics and moving up here to the north, where the lifestyle is actually very good and appealing to a lot of people, having that outdoor style lifestyle. And of course, the cost of living is much lower than the GTA and those kind of things.
Yeah, not even in the same, not even the same province, you'd think, or never mind galaxy.
So one of our recruiters, they went to a recruitment fair, and one thing they did is they brought the MLS listings for all the properties for sale in the district, and they put them up on the table, and they couldn't keep them on the table. People were so interested in the GTA that those flyers were just flying off, and they couldn't keep them on the desks. And there was a lot of interest in our area just because of those cost of housing.
Now, is it harder to recruit for the district than it is for the city?
I would say it's much harder, yes. You don't have the same amount of amenities. There's no access to the international airport right in your backyard.
Right.
So there is things that draw people to the city. They want to work in the high call volume areas. They want to get those skills. They want to use their skills. They've gone to school for it, and they've really trained and practiced to use them. So I find it a little bit easier to recruit in the city. There's a little bit more applications for that type of work. But to be honest with you, that's a fantastic career working in the district as well. It's a lot of money to be made out there. It's a very great lifestyle, and you're an incredibly well-respected individual in that community. So it's something that's it's very rewarding. So I think it's a great career, and it's a great career path, especially for people starting out that want to just start with a little bit of experience.
I was going to say, too, I know there were some big changes to how the district operates in the last couple of years. We've made some big shifts. How has that transition been going?
It's a bit of a mixed bag. What we're really experiencing right now is that staffing shortage. So it's compounding some issues where we want to expand some staff in areas. We want to really increase services, and we're doing a lot of station amalgamations, building new construction and those kind of things. So like the new bases, the new facilities we've created are just fantastic. They're really helping out our paramedics. They're creating a much better life while they're at work. A lot of times these paramedics are also working 24/7. They have a 12-hour shift and a 12-hour on-call. So they may be at that base for 24/7 for their block of either 4 or 7 days. So we really want to provide the amenities that they can live there comfortably. So that means building in things like gyms and exercise boardrooms, places to meet and have themselves entertained, bedroom space that's private so they can get a little bit of privacy during their downtime. So these are all things that we're trying to think of as we build and construct new stations.
And are there other communities where you're still providing housing too, or that's also a challenge?
Oh, absolutely. It's a necessity, and it's built in. The places that we don't have the new stations with bedrooms and things built in, we're going to have apartments or houses rented so that paramedics can have a place to stay. And a lot of those places we're working 24-hour shifts, so you have relief for the 12 hours, and then you need someplace to go during that downtime or your time off. So that's when we really provide those accommodations.
That was I want to talk about the district there. What about some of the challenges of operating here in Thunder Bay?
Some of the challenges of operating in the city of Thunder Bay are just, again, high call volume, high demand for services. A lot of times we're working with allied agencies that are also overtaxed. So when we're expecting a response, we may be limited and have to stage on a scene waiting for police or something like that, which can cause delays and issues as well. We're seeing some socioeconomic issues. We see an increased level of violence on paramedics, which is a severe issue. And we're trying to mitigate that by coming up with new factors and some piggybacking off some of the work that's already been done in areas like Peel and things like that, where they've have external violence against paramedic programs. So those are things that we're looking at adopting and are in the midst of adopting here in Thunder Bay. And we want to make sure that we're really looking after our workforce the best we can.
Yeah, I guess, and that's part of that recruitment drive too, right? Like, encouraging people and showing that you've got something in place to keep them safe and keep them happy.
Well, absolutely. And the other factor that's always taxing on paramedics, it's a very physical job. They're out there lifting people, and they have that physical nature. They're trying to extricate people out of car accidents and things like that. So you have to be physically fit and capable and have the dexterity to be able to do intravenous medications and start IVs, like intubations for those advanced care skills. So you need a lot of dexterity as well. But on top of that is the operational stress that comes with being a paramedic. And that's a real concern. We see a lot of operational stress, and it's an issue that we lose perhaps 10 to 12% of our workforce at any given time that could be off for those reasons. And we need to look after our paramedics, and we need to do a better job of that. And one thing we are doing is we've got a robust mental health program, and that's a conjunction of a peer support and wellness coordinator that's paramedic, so knows the job in and out themselves. That's backed by a whole peer support team in both city and district members and members of the management team. And we also have, through our budget, not even through the benefits, but gone out and contracted a team of clinical psychologists and they are just fantastic. They're working directly with us. They have dedicated appointment spots for all our paramedics. If they need those services, they can get in right away. Preliminary data is showing that we've kind of starting to turn a corner, and we've reduced some of that lost time for operational stress by about 40%.
Oh, wow.
So it's working out really well. It's preliminary data, and we want to keep going with that program and expanding on it because we think it's really benefiting our paramedics.
I know there's also a program coming up that was announced by the province, I think it was last summer, working with Canadian Mental Health Association. I know it hasn't been fully launched at this point, but can you maybe touch on what's going on there?
Yeah, that's an initiative we're really excited about. And what this is teaming up paramedics with a crisis worker, and we have an Indigenous liaison on the team as well, or an Indigenous associate. And what that's going to do is provide a response to those kind of lower acuity mental health and addictions responses that are really kind of taxing on the paramedics. They don't have the most up-to-date skill set for dealing with mental health. So we're getting a team that's really well versed and trained in that, and sending them in. That's, again, that collaboration of a paramedic with all the medical background and the first response background, meeting with a crisis worker in crisis response who has that mental health and addictions background, teaming them up together for these responses, and hopefully help take some of that workload off our paramedics. Again, clear some of those offload delays and work within new mechanisms in the city where we have addictions and mental health resources, and putting them to other alternate destinations and facilities that are better suited for the patient and where we see better outcomes.
I'm noticing a bit of a trend here in a lot of your responses, which is it seems like the goal is to just not necessarily bring people to the hospital if they don't need to go, obviously.
The emergency department's always going to be the primary destination for us as EMS, and it's an incredibly valued resource that we need in our community, and our highest acuity patients need to go there. But what we're seeing is the healthcare system that's overburdened right now. We're seeing people that have to wait for extended hours to try and get into the emergency department because they're just so busy. So we do have other community aspects that we can bring patients to where they're going to receive quicker and more appropriate care. Sometimes they need that longer term care or that follow-up, where the emergency is just not necessarily designed for that. They're meant for acute emergencies. So not necessarily does the emergency, they may have the resources there or the connections and referrals, but they're also dealing with a whole bunch of other issues at the exact same time, which
Sure.
makes it very difficult for capacity.
And in your opinion, is Thunder Bay a little different too because it's a regional hub? Like, do we have different issues here than we would at say, smaller hospitals in other parts of the province?
Oh, without a doubt. We, like you said, we are a regional hub, so we're seeing a lot of interfacility transfers in from other hospitals throughout the region. So we're seeing a lot of higher acute emergencies where it might be beyond their level of care or scope, sending them to Thunder Bay for diagnostic imaging and things like that. So that also increases the need for our Thunder Bay Regional and the capacity demands.
Yeah, I guess, and your staff are in some cases bringing those people there.
Yes, they are. It's not the core of our work, but when it is an emergency or when the patient needs it, we're happy to be there to transport those patients because we are looking after the public, right? So that is our goal, right? To see everybody come through with the most positive outcome that we can possibly get for them.
When we look at your operations, both Thunder Bay and the district, what are some of the things that, some of the misconceptions that you'd really like to be able to push back against?
So there is a little bit of a rumor that I keep circulating, especially around the district, and that's around like rotating closures, blackouts, brownouts, whatever you might call them. And I just want to kind of stem that rumor because we haven't shut any stations down. We're not looking to shut stations down. The only reason that we might not have a station up and running in the district is because of staffing. That is our only concern right now. It has nothing to do with funding cuts or anything like that. We're very well funded to provide the services out to the community. Where we're short is with those human resources and getting the actual paramedics. Because of legislation, we are stuck having 2 paramedics in an ambulance in order to transport a patient. It doesn't work in any other way. The Ambulance Act prevents us to pairing with, like, say, just another type of first responder or somebody with a basic first aid and a paramedic. The legislation prevents us from doing that. You need 2 qualified AMCA paramedics in order to operate that ambulance.
Right, so you couldn't just go out and hire a driver, for example. They have to be a paramedic.
That's exactly it. So it doesn't meet the model. It doesn't meet our Ontario legislation, and that's why we have to operate that way. But it puts under significant pressures, and we run into first response situations out in the district especially, where you have maybe one paramedic responding in an ambulance, and then you have to get another transporting ambulance from another community that may be an hour away. So that's also taking that transporting crew out of their community for several hours to transport that patient. But it's just sometimes geography gets in the way of operations, and just the lack of actual human resources to distribute everybody out there. We have a lot of shifts to cover every day.
Yeah.
And not necessarily do we have enough paramedics to cover them. So
And we're a big district.
we are a massive district. It's a very big service. We cover a huge area of 103,000 square kilometers, and it is vast. It's a vast region, and it's a lot of transporting distance.
Looking ahead to this year, we're in 2025 now. Anything that's really your big priority for the year?
Again, our top priority is going to be getting the staffing numbers up. So preliminary right now, we just went through our spring hire cohort. We're excited to see a large number of applicants this year. So we're hoping to get as many onboarded as possible. We're just setting up for that onboarding, and we're going to continue it throughout the next few years, really trying to build a robust workforce that's, again, has all those mechanisms to build that resilience and stay at work, and make sure they're comfortable and happy while they're doing this work, and hopefully keep them around for their entire careers.
And this, as you kind of alluded to there, this isn't a one-year issue. Like, we can't just solve this with a big hire. There's going to be a bit of a waterfall effect here.
Absolutely. This is going to be a multi-year initiative, and it's something that we've been working on for years as it is. It's not the first time that we've kind of gone out and tried to recruit. We've been recruiting all throughout the year, but everybody's kind of competing right now. We have services all over the north that are competing for the people out of our own college, the graduates, and we have the rest of Ontario that's fighting for every paramedic that's out there, because we're all short on staff, and we could all use those resources, and everybody in the public needs them. They need access to a paramedic at any given time when they need to call 911 for a medical emergency. So we want to make sure that we can provide that response.
Yeah, you're going to keep running off those MLS listings, right, to show.
Absolutely. We've been trying to attract everybody to the area that we can.
Yeah. Shane, anything else you want to add before I let you go today?
You know what? I just want to say a big thank you to our paramedics that are out there, both in the city and across the entire district. Their unwavering commitment and dedication to our public is outstanding. They have been under pressure for a number of years. They have really been working through it. Sometimes they've sacrificed their own personal, vacations or, holidays, and being with their family so that they can service their community. And they really are the heroes that are keeping everything together out there. So I just want to give a big thank you to our paramedics, and just know that myself and the entire public appreciates them to no end.
Yeah. Shane, appreciate you coming in today. Thank you very much.
Thank you very much, Jeff.
That is Shane Muir. He is the Chief of Superior North EMS, and he joined me today in the Minutes studio. And a big thanks for listening to the Minutes this week. Of course, if you want more information about City Council, agendas, or minutes, just visit thunderbay.ca/council. If you want to listen to past episodes or maybe provide some feedback, visit thunderbay.ca/theminutes. You can also find the Minutes wherever you get your podcasts, plus you can find us on YouTube and on our website as well. That's thunderbay.ca/theminutes. If you want to keep your finger on the pulse of what's happening at City Hall, just hit that subscribe button. I'm Jeff Walters. Thanks for watching this week. We'll chat again next week. Make it a great day.